Over the last 24 hours, we have confirmed 23 new cases of COVID-19, bringing the provincial total to 97, up from 74. As I reported yesterday, we now have confirmed cases in every health zone in Alberta. Currently, 5 cases are hospitalized, of which 2 were admitted to the ICU. These are the same numbers as previously reported. All other confirmed cases are self-isolating at home and are expected to make a full recovery. As was announced by Premier Kenney earlier this afternoon, we are taking aggressive new measures in an effort to reduce the spread of COVID-19. The Government of Alberta is finalizing the signing of a state of public health emergency, empowering authorities under the Public Health Act to respond to the COVID-19 pandemic. New public health measures under this state of emergency will limit the time Albertans spend in large crowds and crowded spaces. Effective immediately, mass gatherings are limited to no more than 50 people. This is inclusive of places of worship, funerals, and weddings, where Albertans must ensure appropriate social distancing and other sanitization practices. Grocery stores, shopping centres, healthcare facilities, airports, and other essential services are not included. Any other organized gatherings of more than 50 people must be cancelled immediately. All Albertans are prohibited from attending public recreational facilities and private entertainment facilities, including casinos, racing entertainment centres, and bingo halls. They should also not attend all recreational facilities, gyms, arenas, science centres, museums, art galleries, community centres, fitness centres, swimming pools, and libraries. This prohibition also extends to attending bars and nightclubs where minors are prohibited by law. Sit-down restaurants, cafes, coffee shops, food courts, and other food-serving facilities, including those with a minor's allowed liquor license, are limited to 50% capacity to a maximum of 50 people. At this time, not-for-profit community kitchens, soup kitchens, and religious kitchens are exempt, but sanitization practices are expected to be in place, and support will be in place for this practice. Food services and work camps are also exempt, but in addition to appropriate sanitization practices, arrangements should be made to provide for workers in camps should they need to be self-isolated. The only means we have to prevent the virus from spreading is to limit contact between people. The more we can slow the spread of the virus down, the less likely it is that there will be a surge of cases that overwhelm our health system's capacity to care for those who need hospitalization or intensive care. You may have heard this described as flattening the curve. This is why we are taking these measures. In addition, the healthcare system is preparing for any increase in the number of cases that need hospital care. Alberta Health Services is postponing all scheduled and elective surgeries. Urgent and emergency surgery, as well as oncology and scheduled cesarean procedures, will continue. AHS will be contacting Albertans scheduled for procedures and will reschedule as soon as possible. We do not have a timeline for this due to the ongoing pandemic. We understand that many of you will be anxious to hear from AHS about your surgery. We ask for your ongoing patience. Please do not call 811 or the clinic. You will be called by AHS. Frontline teams will be redeployed to other areas of the healthcare system to meet demand and ease pressure points. I understand the tremendous impact all of these measures will have on all of us. We will get through this together, but we need your help and support by following these orders and all other public health guidance.